we're doing a lot around artificial intelligence. So we've got a dermatology clinic whereby GP refers into a photographer, want for a better word, where a picture gets taken of the area that there's a concern, and that picture is reviewed from an AI perspective. Then a consultant will also look at that and decide whether we actually need to see that patient or not, whether it's cancerous or whether it's something more serious. And then they can bounce in. If it's not, then they stay out in community. So AI can't be mistaken. With the AI, we have to also remember the genomics agenda, which is getting an aggressive pace now. So we'll have a number of drugs where we will test the patient first to decide which drug is best for them, and that's going to put all of the protocol-driven aspects and all the guidelines fully up in the air. So you get some people who would bounce straight to third-tier medication, versus others which would just be first tier based on what the genomic makeup is for that patient.
Yeah, and that's a really interesting area that certainly we've talked about for a few years, about the art of the possible, and I think there's a perception that maybe it's still a way off. But how close do you think it is before you're using the genomic testing route with a level of frequency?
Well, we already are. There's 2 drugs NHS approved recently, which needs genomics. The National Genomics Programme is just finalising the tender, so we will have all those GMSAs in place. There's JDs already been written for lead pharmacists for each GMSA, so that recruitment should start fairly shortly. But the key thing is to educate all pharmacists and community pharmacists around genomic medicine and how it does work. But then the other element which I go back to is around the artificial intelligence. That's going to build into electronic prescribing systems. So you'll have a position whereby the AI will inform you when you need to do dose adjustments or even change drugs. So if someone's renal function starts to deteriorate or liver function is not where it should be. We've already got a rules-based post in UHB which does semi-do that, but not to the extent we'd like it to. So from a clinical pharmacy could change dramatically going forward, because the AI could even inform you when you're about to prescribe a drug that you need to reduce the dose due to the renal function that the patient's got.